make one product and one drug for everyone.
The old apothecaries, the old chemists, we used to make medications individually for patients. We're bringing that science back to the industry.
And we're going to go through what compounding chemistry is and what is it used for and the whole history behind it.
Welcome to Daily Dose with Dr. Tanya. We're going to talk everything about health, wellness, beauty, and things between. This is your space where we will have real conversation, real results for real people. So let's get started.
Ancient times, medicine was very different. It wasn't for everyone, like one product and one drug for everyone. It used to be catered and tailored to patients' needs, patient's body type, and based on their unique composition, their genetics and all that. But we have then moved on from that and things have changed. Now, I can tell you as a doctor, I absolutely love medications that's formulated and tailor-made for the patient. And we are here in such a facility with the compounding chemist himself, Michael Duan. And we're going to go through what compounding chemistry is and what is it used for and the whole history behind it. So let's talk to Michael. Hello, Michael. Thank you for coming.
Thanks for coming, and thanks for everyone for spending the time to listen on what compounding is about. So here at ICCC, we do specialize in compounding.
Yep.
The history of compounding is that, yes, the old apothecaries, the old chemists, we used to make medications individually for patients. The potions and things that you see that in the old movies, that was what was actually done. We took active ingredients, we mixed something customized for that patient, for the particular symptoms to treat that patient. As the years went by with the industrialization and the manufacturing, tablets became a mainstay, but that was to make people fit into the tablets that were being made, as opposed to making medications for the patient. So here at ICCC, we're bringing that science back to the industry, to the people.
It's really amazing, like what you were saying. Even like if you look at any ancient medical practices, like I can talk about Ayurvedic practice. See, Ayurvedic practice, each medicine is formulated uniquely based on that person's unique body type, their inflammation and all of that. And they had science behind it. Although evidence-based medicine wasn't as sharp as what it is now, they still had their science, the Ayurvedic science and philosophies behind it. And now you can see that this is a way of us connecting back to the ancient, the real medicine and formulation that was there, was present at that time. And I'm really like excited to see like what you do here as well, like what I know as a doctor, the formulations that I prescribe for patients personally from Amtan is for skin formulations. I do hormone replacement therapies, pediatric and pain management. These are like the main things I do.
Correct.
Is that the same that you see here as well?
Yes, correct. So first of all, let's start with pain. Now, everyone experiences pain, but pain exists in multiple different ways. So at a compounding facility like ICCC, we can work with the doctor and the patient to see where the pain comes from and how to deliver that medication to the patient. Some patients may like an oral medication, however that doesn't work for everyone because of the side effects.
Yeah.
So we make pain creams that will go past through the skin, transdermal pain creams that deliver medications directly to the site of pain, the site of injury. So things like that we do quite common. Hormone optimization. Now, everyone's hormones are different because our blood levels, they fluctuate.
Yeah.
So being able to accurately work on a dose that we can deliver in terms of a cream or a troche to a patient, that's something that individualized precision medicine can do. So that's what we do here at the compounding.
It's amazing. Now, any chemist compound, I'm sure people will want to know, like they may have a chemist near their house. Can anybody do this? Just for the viewers?
Chemists are trained to compound, however it is split up between simple compounding and complex compounding. Simple compounding like salicylic acid creams and whatnot, yes, most chemists can do. However, in a complex situation where we have a lot more individualized dose and individualized dosage forms. We do require the facility that is approved to be able to compound first and foremost.
Yeah.
And we also need the right equipment. We also need the right training as well. So there's a lot of different things that's involved being able to deliver that medication to you in a compounded form. Because it's compounding doesn't mean it's low quality, because we're actually individualizing it for you. We actually compound similar to the GMP standards that are required of the big pharma manufacturing.
This is great because it's a great insight, and also when you go to doctors, not all doctors may be able to help you with unique formulations and stuff. So it's important to check with your medical practice whether they can do any unique formulations, but not for everything. You know, like modern medicine is great because it has got life-saving drugs, and that is very essential. But then there is the in-between conditions where you need to have unique formulation that suits that particular body's microbiome, inflammatory status, and genetics, and so on, that the patient and the doctor will sit and discuss and do the formulation, and then a chemist like yourself will be able to compound it based on what the formulation prescription actually means.
So we're compounding formulations that's not readily available to patients, and we'll be able to deliver that to you. We also compound special access scheme medications and access to novel, innovative medicines that's not widely available as well. So there's certain conditions that have research compounds that haven't quite made it out there yet, but through compounding, we have the ability to be able to deliver that to patients.
Oh, isn't that amazing? So I'm really feeling so happy that this is where medicine started. This is like in the ancient time, very individualized, very personalized. And now we have the opportunity to go back into certain aspects of this unique formulation, tailor-made for each patient based on their individual needs. So I feel like, you know, this is kind of like a little bit getting back into that ancient form.
Great, thank you.
Thank you so much, and stay tuned. We have many more interesting episodes coming. Thank you. Bye.